Hi, this is Dr. Robert Chao from Northern Virginia, reporting live for Room Now from ACR 2023. As we're wrapping up day one here of ACR, I really wanted to point out one really interesting abstract where the worlds of, I think, technology and rheumatology really intersect. And this was abstract 0530. And this focused on the impact of upadacitinib as measured by a wearable medical device focusing on physical activity in patients with ankylosing spondylitis from the Select Access 2 trial. So that was kind of a mouthful, but pretty much what they did is they looked at over 400 patients with either an inadequate response or intolerance to biologics, and they were randomized to receive either upadacitinib 15 milligrams daily or a placebo. Pretty much they slapped on either it was called a medical grade wrist worn device, which is think Apple Watch or Fitbit and whatnot, for about 14 weeks. And they noticed that at 14 weeks, patients treated with upadacitinib had a numerical improvement in steps per day with about 11% improvement compared to placebo. Notably, in patients with a sedentary lifestyle at baseline, a 22% improvement was observed in the upadacitinib group compared to 4% in the placebo group. In patients with an active lifestyle at baseline, numerically better maintenance of daily step counts were maintained compared to placebo, where they found that sometimes the step counts declined over time. I think overall, this data is what we expected. We expect that when we make patients feel better, they're going to move more. But I think a few points I wanted to point out are, one, it's good to have actual data, how much more? And if we can quantify that by steps and the improvement of physical activity and movement, I can see that maybe even being used as a measurement marker in future studies. And I think, we also have way more data now from these smartwatches or smart devices. I think Fitbit really was a hot thing, I want to say about a decade ago. I looked at my Apple Watch this morning, and I noticed there's just so much more data than just steps climbed. Quick look, I saw there's obviously stairs climbed, there's METs even, there's walking speed, walking step length, heart rate, of course, walking asymmetry. They can kind of tell you which side you're leaning on more. I think that's also very interesting for our diseases. Calories burned, and even more data that we don't even know how to use yet. I think these devices, we know they're always collecting data in the background, whether we know it or like it. Many people have them, and there could be even years of data, including prior diagnosis and prior drug use that we haven't tapped into yet. So I think very promising initial study focusing on these smart devices in our diseases. I hope to see more in the future and maybe even at this ACR. But thank you for tuning in to Room Now for live coverage of ACR 2023. And please feel free to follow me on Twitter. Oh, I guess it's called X. Follow me on x.com at Dr. RBC. Thank you.